ನಮಸ್ಕಾರ ವೀಕ್ಷಕರೇ, ಯೆನೆಪೋಯ ಡೀಮ್ಡ್ ಟು ಬಿ ಯೂನಿವರ್ಸಿಟಿ ಪ್ರಸ್ತುತಪಡಿಸುವ YENAROGYA ವಿಶೇಷ ವೈದ್ಯಕೀಯ ಸಂವಹನ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಸ್ವಾಗತ. ನಾನು ದಿವ್ಯಾ. ಇವತ್ತಿನ ನಮ್ಮ ಒಂದು ಸಂಚಿಕೆಯಲ್ಲಿ ಹೈಪೋಥೈರಾಯ್ಡಿಸಮ್ ಇದರ ಕುರಿತಾಗಿ ನಾವು ನಿಮಗೆ ಮಾಹಿತಿಯನ್ನು ಕೊಡ್ತಾ ಇದ್ವಿ. ಹೈಪೋಥೈರಾಯ್ಡಿಸಮ್ ಅಂದರೆ ಏನು, ಜೊತೆಗೆ ಇದಕ್ಕೆ ಯಾವ ರೀತಿಯಾದಂತಹ ಚಿಕಿತ್ಸೆಗಳನ್ನ ನೀಡಲಾಗುತ್ತೆ, ಹೋಮಿಯೋಪತಿಯಲ್ಲಿ ಇದಕ್ಕೆ ಯಾವ ರೀತಿಯಾದಂತಹ ಚಿಕಿತ್ಸೆಗಳನ್ನ ನೀಡಲಾಗುತ್ತೆ ಅನ್ನೋದರ ಕುರಿತಾಗಿ ನಾವು ನಿಮಗೆ ಮಾಹಿತಿಯನ್ನು ನೀಡ್ತಾ ಇದ್ವಿ. ಈ ಕುರಿತು ಮಾಹಿತಿಯನ್ನು ನೀಡೋದಕ್ಕೆ ನಮ್ಮ ಜೊತೆ ಇದ್ದಾರೆ ಯೆನೆಪೋಯ ಹೋಮಿಯೋಪತಿಕ್ ಮೆಡಿಕಲ್ ಕಾಲೇಜ್ನಲ್ಲಿ HOD ಮತ್ತು ಪ್ರೊಫೆಸರ್ ಆರ್ಗನ್ ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ಅಲ್ಲಿ HOD ಮತ್ತು ಪ್ರೊಫೆಸರ್ ಆಗಿ ಕಾರ್ಯನಿರ್ವಹಿಸುತ್ತಿರುವಂತಹ ಜೆನಿಟಾ ಫರ್ನಾಂಡಿಸ್ ಅವರು ನಮ್ಮ ಜೊತೆ ಇದ್ದಾರೆ. ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಆತ್ಮೀಯವಾದಂತಹ ಸ್ವಾಗತ ಡಾಕ್ಟರ್. ಈ ಒಂದು ಹೈಪೋಥೈರಾಯ್ಡಿಸಮ್ ಅಂದ್ರೆ ಏನು, ಜೊತೆಗೆ ಹೈಪೋಥೈರಾಯ್ಡಿಸಮ್ಗೆ ಹೋಮಿಯೋಪತಿಯಲ್ಲಿ ಯಾವ ರೀತಿಯಾದಂತಹ ಚಿಕಿತ್ಸೆ ಪದ್ಧತಿಗಳಿದೆ, ಇದೆಲ್ಲದನ್ನ ಕೂಡ ನಾವಿವತ್ತು ಈ ಸಂಚಿಕೆಯಲ್ಲಿ ತಿಳಿಸ್ಕೊಡ್ತಾ ಇದ್ವಿ. ಮೊದಲನೇದಾಗಿ ಈ ಒಂದು ಎಂಡೋಕ್ರೈನಲ್ ಸಿಸ್ಟಮ್ ಅಂದ್ರೆ ಏನು ಅಂತ ತಿಳಿಸ್ಕೊಡಿ.
There is a system in the body which we call as endocrinal system, and this is responsible for the production of many hormones in the body, and so this helps for the growth, such as we have the growth, then reproduction system, then we have various things like which takes care of various things in the body. Now what happens is that I would like to today speak about this hypothyroidism. Endocrinal system itself is a very vast chapter which covers up many things. It's a big ocean. So let me just take today a simple small topic of hypothyroidism. Now, due to the stress level, see, when there were days, what used to happen before is, for example, if you speak about heart attacks or what you call it as a myocardial infarction, those days we had like, you know, if a person is having a fat, smoking, then etc., or you know, the cholesterol levels are high, these were the various causes. No doubt these are the causes today also, but first cause what we speak of is stress. So same thing when you speak about hypothyroidism. Now this is a condition where the thyroxine production in the body is less. The patient is deficient of this thyroxine hormone, which gives rise to various conditions, and so we name it as hypothyroidism. When we send this patient, we send for T3 levels, T4 levels, and TSH levels. Now what happens is that in this condition of hypothyroidism, the important factor today is stress. Lady has to do work at home, she has to go for a job, then she has to take care of her children. In this process, what you see is the anticipatory anxiety is developed more, and because of this anticipatory anxiety, there are many chances of these ladies going, or for that matter even the young girls going into hypothyroidism. It affects the body. See, we always believe that this causes disease, that causes disease, but today means we give importance to the physical factors, etc., but very important for us today also, because if we go in the details, 90 to 99% causes are in the mind. So when there is lot of anticipatory anxiety, we are inviting various diseases. For example, gone were the days when we studied that after 40 there are chances of heart attack with other various reasons, but today if you see, even an 18-year-old dies of heart attack. You just other day there was a school there was news that a 15-year-old girl died of heart attack. So it is very shocking. The girl is lean, thin, there is no levels of high cholesterol, etc. So somewhere down the line we see that stress is the major cause of the disease. So in hypothyroidism also what we see here, stress factor is more. A child is going for the for example, your child is going for the engineering or medicine, the amount of projects they go through, the way their food style is hampered, the biological clock is disturbed. If you take overall, where in the IT sector we get lot of cases of hypothyroidism only because of the disturbance of the biological clock. Their food habits are not right, their sleeping patterns are not right, and that is why what happens is that we see these girls today. If you see, gone are the days when we, in the olden days, we could see, you know, all slim, trim girls. Now you see overweight girls. This is nothing. It's not only because that they are working or so. It's because somewhere down the line they are mentally not comfortable, healthy. They are disturbed. So yes, very much mental disturbance. So there are various reasons for this. So I just stressed upon the mind effect, how it causes, what can lead to hypothyroidism. The reason why I stress upon this mental factor is because we are going towards more into hypothyroidism because of stress factors. So when the thyroxine in the body is deficit due to other various causes also, for example, it may be because of hereditary also, along with stress. One is stress, second hereditary factor. Then there are certain ingredients in our body or maybe in our food which acts as anti towards the production of thyroxine, or maybe because the food is deprived of iodine, etc.
ಓಕೆ ಅಂತ ಹೇಳಿದ್ರೆ ಈ ಒಂದು ಎಲ್ಲ ರೀತಿಯಾದಂತಹ ಏನು ಸಮಸ್ಯೆಗಳಿದ್ದಂಥ ಸಂದರ್ಭಗಳಲ್ಲಿ ಹೈಪೋಥೈರಾಯ್ಡಿಸಮ್ ಅನ್ನುವಂಥದ್ದು ಬರುತ್ತೆ ಅಂತ ಹೇಳಿದ್ರೆ, ಅಥವಾ ಈ ಒಂದು ಫುಡ್ ಹ್ಯಾಬಿಟ್ಸ್ ಆಗಿರ್ಬೋದು, ಅಥವಾ ಅವರಲ್ಲಿ ಇರುವಂತಹ ಒಂದು ಚಟುವಟಿಕೆಗಳು ಜೊತೆಗೆ ಮೆಂಟಲಿ ಸ್ಟ್ರೆಸ್ ಕೊಡುವಂತಹ ಒಂದು ಸಮಸ್ಯೆಗಳು ಕೂಡ ಈ ಒಂದು ಹೈಪೋಥೈರಾಯ್ಡಿಸಮ್ಗೆ ಕಾರಣಗಳಾಗುತ್ತೆ ಅಂತ ತಿಳಿಸ್ಕೊಟ್ರಿ. ಓಕೆ, ಹಾಗಾದರೆ ಈ ಒಂದು ಹೈಪೋಥೈರಾಯ್ಡಿಸಮ್ ಇರುವಂಥವರಲ್ಲಿ ಯಾವ ರೀತಿಯಾದಂತಹ ಲಕ್ಷಣಗಳು ಕಂಡುಬರುತ್ತೆ ಅನ್ನೋದನ್ನು ತಿಳಿಸ್ಕೊಡಿ.
Yes, there are many symptoms which are shown when a person of hypothyroidism comes to you. Now whenever a patient comes to you, especially girls, they are very much worried that they are overweight. They are not aware that they are having hypothyroidism. They just come to you, doctor, I want to lose weight. In homeopathy, do you have something? But to tell you frankly, as such, giving medicine for just overweight, there is nothing. You have to go to the root cause. You have to understand the root cause. One of the cause is hypothyroidism. You have overweight. There are other causes which leads to overweight. So one which you take as hypothyroidism, the patient comes to you, you know that this girl, or for that matter this lady, is concerned about her weight. She is overweight. Now here when we sometimes what happened, clinically it shows positive for hypothyroidism, but when you consider the investigations for T3, T4 and TSH levels, sometimes they show normal, even though clinically that lady is showing the features of hypothyroidism. So like for example, I can tell you, like, you know, she can give you certain symptoms, like she may tell you, now these symptoms are, you know, divided into just start of hypothyroidism and later when it is too much, where clinically plus investigatory findings also they are showing as hypothyroidism, then the symptoms are excessive. But at the starting she may just complain of like, I'm losing hair, my texture of the hair is rough, then I am putting on weight. Then other thing we see that girls complain about, I get angry. They may not tell you that they get angry fast. What happens is that if the girl is accompanied by a mother, she tells that nowadays she is very irritable, short tempered, etc. Otherwise, for that matter, if the girl is introspecting, she may herself confess that I get angry very soon. I'm short tempered. Sometimes I get tremors, I get perspirations. So if that girl is introspecting, she may go into the detail, or she may just come like, I am overweight. Then sometimes then when you ask her for, you know, just lift your hands and you see for some tremors, then you get a little to go beyond in the medicine. They may have something called as clubbing, like, you know, girls are more worried about their nails, you know, but here what you see, like the angle of the nail bed is lost, so they are not happy that my nails don't look good where I can paint them and look beautiful. So these are then other symptoms. What we see here is breathlessness is there, loss of hair is there. Then they feel weakness, tiredness early. Then as far as, you know, this condition is more common in the ladies as compared to men. You hardly get to see any cases in the men, but it is more common in the ladies. What you see here is the menses. They may have, you know, for months together amenorrhea, suddenly followed by heavy menses flow. So these are few symptoms which we see in the hypothyroidism, which is commonly seen. Yes, they even cannot bear cold. Like for example, when you just go to a hill station where everybody enjoys the climate, but they prefer like covering themselves. It's unbearable.
ಓಕೆ, ಎಸ್ ಡಾಕ್ಟರ್, ಏನು ಈ ಒಂದು ಹೈಪೋಥೈರಾಯ್ಡಿಸಮ್ ಇರುವವರಲ್ಲಿ ಯಾವ ರೀತಿಯಾದಂತಹ ಲಕ್ಷಣಗಳು ಕಂಡುಬರುತ್ತೆ ಅನ್ನೋದನ್ನು ತಿಳಿಸ್ಕೊಟ್ರೆ, ಇನ್ನಷ್ಟು ಈ ಒಂದು ಹೈಪೋಥೈರಾಯ್ಡಿಸಮ್ಗೆ ಯಾವ ರೀತಿಯಾದಂಥ ಚಿಕಿತ್ಸೆಗಳಿದೆ, ಹೋಮಿಯೋಪತಿಯಲ್ಲಿ ಯಾವ ರೀತಿಯಾದಂಥ ಚಿಕಿತ್ಸೆ ಇದೆ ಅನ್ನೋದನ್ನು ತಿಳ್ಕೊಳ್ತೀವಿ ನಿಮ್ಮಿಂದ. ಆದರೆ ಅದಕ್ಕೂ ಮುನ್ನ ಶಾರ್ಟ್ ಬ್ರೇಕ್. ವಿರಾಮದ ಬಳಿಕ ಯನಾರೋಗ್ಯ ವಿಶೇಷ ವೈದ್ಯಕೀಯ ಸಂವಹನ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಸ್ವಾಗತ. ವೀಕ್ಷಕರೇ, ನಾವು ಹೈಪೋಥೈರಾಯ್ಡಿಸಮ್ ಇರುವಲ್ಲಿ ಯಾವ ರೀತಿಯಾದಂತಹ ಲಕ್ಷಣಗಳು ಕಂಡುಬರುತ್ತೆ, ಜೊತೆಗೆ ಅವರಲ್ಲಿ ಯಾವ ರೀತಿಯಾದಂತಹ ಒಂದು ವೀಕ್ನೆಸ್ಗಳು ಕಂಡುಬರುತ್ತೆ ಅನ್ನೋದನ್ನ ನಾವು ತಿಳ್ಕೊಂಡ್ವಿ. ಇದೀಗ ಈ ಒಂದು ಹೋಮಿಯೋಪತಿಯಲ್ಲಿ ಯಾವ ರೀತಿಯಾದಂತಹ ಚಿಕಿತ್ಸೆಗಳನ್ನ ನೀಡಲಾಗುತ್ತೆ, ಈ ಒಂದು ಹೈಪೋಥೈರಾಯ್ಡಿಸಮ್ ಇರೋರಿಗೆ ಚಿಕಿತ್ಸಾ ಪದ್ಧತಿ ಹೇಗಿದೆ ಅನ್ನೋದನ್ನ ತಿಳ್ಕೊಳ್ಳೋಣ. ಡಾಕ್ಟರ್, ಈ ಒಂದು ಲಕ್ಷಣಗಳ ಬಗ್ಗೆ ತಿಳಿಸ್ಕೊಟ್ರಿ. ಈ ಒಂದು ಹೈಪೋಥೈರಾಯ್ಡಿಸಮ್ ಅಂದ್ರೆ ಏನು, ಅವರಲ್ಲಿರುವಂತಹ ಸಿಂಟಮ್ಸ್ಗಳು ಹೇಗಿರುತ್ತೆ ಅನ್ನೋದರ ಕುರಿತಾಗಿ ನೀವು ತಿಳಿಸ್ಕೊಡ್ರಿ. ಇದೀಗ ಹೈಪೋಥೈರಾಯ್ಡಿಸಮ್ ಇರುವವರಿಗೆ ಹೋಮಿಯೋಪತಿಯಲ್ಲಿ ಯಾವ ರೀತಿಯಾದಂತಹ ಚಿಕಿತ್ಸಾ ಪದ್ಧತಿ ಇದೆ ಅಥವಾ ಯಾವ ರೀತಿಯಾದಂತಹ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಇದೆ ಅನ್ನೋದನ್ನ ತಿಳಿಸ್ಕೊಡಿ.
In homeopathic system of medicine, we consider a person as a whole. We do not say this is the right hand, I am going to treat the right hand or left hand. No, we consider a person as a whole, which we call it as a holistic approach. That is, and not only the holistic approach towards a person, but we consider individualization. Like for example, every patient for us is a new patient. Even if the diagnosis is a hypothyroidism for one patient, the second patient, or even if you have 10 cases in your OPD for that moment, every case is different for us. Okay. The very important thing here is we try to understand the patient from the mind and the physical level before we select a medicine. Because our system totally gives importance to overall of the person. For example, if I am just considering the gland, the investigation levels of T3, T4 and TSH and treating, I am just treating the hypothyroidism. Okay. I am not giving importance to the causative factor which might have led to this cause of hypothyroidism, which I may cover up into the mind symptoms. For example, the child which is forced into engineering, who is actually not even having the caliber but to keep the parents' dreams, goes there, is stressed out at the hostel, at the class, etc. And these are some stress factors which may be disturbing even the pattern of the child in the routine activity. So at this moment what happens, the reflected part is hypothyroidism, the diagnostic part is hypothyroidism, but did I as a parent ask what may be the reason for it? Or this happens only when the patient comes to us and we try to analyze and go to the root cause. Because basically in homeopathy we treat of uprooting the disease, that is removing the disease from the roots. Okay. Not just cutting the stem of the root and then you get again a full blown picture, or neither suppress the condition. So we want to know the whole of the patient, like the holistic approach. Now very important to us is, I told you that the patient may come like, doctor give me, like I have some patients coming and saying I am overweight, please prescribe some medicines because I heard that homeopathy can help you to lose the weight. There may be many medicines coming up with the brands that such and such medicine help you lose weight, but again once I will stress on this, let's go to the cause factor. It may be hypothyroidism, it may be polycystic ovarian disease, and again let's go one step ahead and try to understand they are interlinked. Okay. And that is why hypothyroidism, polycystic ovarian disease, etc., and then further these go into the, when the person is carrying this condition, further in a long run can also be very that person is likely to suffer from diabetes mellitus, hypertension, etc. So very important to us in homeopathically, we see the individualization of the patient comes to us, we go to the depth of the case. What we have is a life space investigations. We try to understand the child. See, for example, each person is different, I said. Yes. If for example now there is some bad incident happened, you see an accident early morning, you are disturbed throughout. For one person, okay, that moment the person is disturbed and then later the person is fine. So each one's reaction towards anything, towards environment is differing. So in this basis each one is different. So you try to understand the mind, not only in case of this condition but any condition for that matter. Each one of us is different. There may be thousands of drugs for hypothyroidism, there may be thousands of drugs for fever, but we individualize on the basis of some characteristic symptoms. So this is how we differ from the other system of medicine. So in homeopathy this is our approach, giving importance to the individualization, where there may be various reasons why this person is reflecting out with this condition. So in a short way, because again homeopathy itself is a very big ocean, so in short I would like to say like this is the way we manage. But along with that we also advise regarding food I told you when I was just talking, I think so I mentioned that cabbage is one of the vegetable which should not be taken because it acts as an anti-production of thyroxine. It does not allow the production of thyroxine. So avoid this cabbage, avoid oily foods. See that the patient is told that go for walks. Then very important concept is the let go concept. Let go in the sense, like, we come across, somebody says something to me and I carry it for 2 days, 3 days. Why did that person behave with me like this? The sensitivity levels are there in many people today because the tolerance power of each one is gone down, and we are carrying many things like, why she said this to me, why this happened to me, like that. So learn to let go certain things which have happened in the past, or maybe which hurts you. So you are giving a peace of mind, which is very important. So indirectly you are also controlling your anxiety levels. So this let go concept is very important. And as you see today, yoga is one of the very nice way of exercise which helps to get rid of many diseases, helps you look young. So I prefer that the patient of hypothyroidism also has a yoga in the morning for some time, also goes for walk about at least 30 minutes.
Yes.
Then have a good food, then avoid the what do you say, the
Oily
outside
foods,
food,
junk foods.
junk foods, and preferably go for having the raw form of vegetables in the form of salads, and no doubt can have non-veg, but more so you can go for the raw form of salads, the natural preparation of food which is at home with hygienic conditions. Avoid this fancy foods and different types of sauces which is used now, which is more latest, fast foods, etc., which are not good for health. So these things have to be taken into mind, and I think this should help much better than worrying about it.
Okay.
The very thing is inside, I am happy,
Hmm.
and everything around you is more happy.
ಎಸ್ ಓಕೆ. ಎಸ್ ಡಾಕ್ಟರ್, ಎಷ್ಟೊತ್ತೇನು ಈ ಒಂದು ಹೋಮಿಯೋಪತಿಯಲ್ಲಿ ಯಾವ ರೀತಿಯಾದಂತಹ ಚಿಕಿತ್ಸೆ ಪದ್ಧತಿಗಳಿದೆ, ಜೊತೆಗೆ ಒಬ್ಬ ಥೈರಾಯ್ಡಿಸಮ್ ಇರುವಂತಹ ರೋಗಿ ಯಾವ ರೀತಿಯಾದಂತಹ ಎಚ್ಚರಿಕೆಯ ಕ್ರಮಗಳನ್ನ ಅವನು ತೆಗೆದುಕೊಳ್ಬೇಕು, ಈ ಒಂದು ಫುಡ್ ಹ್ಯಾಬಿಟ್ಸ್ ಆಗಿರ್ಬೋದು ಅಥವಾ ದಿನನಿತ್ಯ ಅವನು ಮಾಡುವಂತಹ ಚಟುವಟಿಕೆಗಳಾಗಿರ್ಬೋದು, ದಿನನಿತ್ಯ ಚಟುವಟಿಕೆಗಳಲ್ಲಿ ಯೋಗ ಆಗಿರ್ಬೋದು, ಎಕ್ಸಸೈಸಸ್ ಆಗಿರ್ಬೋದು, ಇದೆಲ್ಲದನ್ನ ಕೂಡ ಮಾಡಬೇಕು ಅಂತ ಹೇಳಿದ್ರೆ ಇನ್ನಷ್ಟು ಒಂದು ಮಾಹಿತಿಯನ್ನು ತಿಳ್ಕೊಳ್ತೀವಿ ನಿಮ್ಮಿಂದ. ಆದರೆ ಅದಕ್ಕೂ ಮುನ್ನ ಶಾರ್ಟ್ ಬ್ರೇಕ್. ವಿರಾಮದ ಬಳಿಕ YENAROGYA ವಿಶೇಷ ವೈದ್ಯಕೀಯ ಸಂವಹನ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಸ್ವಾಗತ. ವೀಕ್ಷಕರೇ, ಹೈಪೋಥೈರಾಯ್ಡಿಸಮ್ ಅಂದ್ರೆ ಏನು, ಯಾವ ರೀತಿಯಾದಂತಹ ಲಕ್ಷಣಗಳಿರುತ್ತೆ, ಜೊತೆಗೆ ಹೋಮಿಯೋಪತಿಯಲ್ಲಿ ಯಾವ ರೀತಿಯಾದಂತಹ ಚಿಕಿತ್ಸಾ ಪದ್ಧತಿಗಳಿದೆ, ರೋಗಿಗಳು ಯಾವ ರೀತಿಯಾದಂತಹ ಒಂದು ಎಚ್ಚರಿಕೆ ಕ್ರಮಗಳನ್ನ ತೆಗೆದುಕೊಳ್ಬೇಕು ಅನ್ನೋದರ ಕುರಿತಾಗಿ ನಾವು ತಿಳಿಸ್ಕೊಟ್ವಿ. ಇದೀಗ ಈ ಒಂದು ಲೆಟ್ ಗೋ ಥೆರಪಿ ಅಂದ್ರೆ ಏನು ಅಂತ ತಿಳ್ಕೊಳ್ಳೋಣ. ಎಸ್ ಡಾಕ್ಟರ್, ನೀವು ಮಾತಾಡ್ತಾ ಹೇಳಿದ್ರಿ ಈ ಒಂದು ಲೆಟ್ ಗೋ ಥೆರಪಿ ಅಂದ್ರೆ ಏನು ಅಂತ. ಲೆಟ್ ಗೋ ಥೆರಪಿ ಅಂದ್ರೆ ಏನು ಅಂತ ತಿಳಿಸ್ಕೊಡಿ.
Actually, to frankly speak about these two little words, but it has a deep meaning.
Yes.
If you see the overall scenario of today and the ancient era, or like our grandparents and all, if you see at our tolerance power, it is very less. We as children, we were totally different from what children are today. They are just rushing. They have not enjoyed the child, youth, etc.
Yes.
Emotions are somewhere dead. They do not carry these emotions, but the sensitivity levels towards somebody's reactions or somebody's talks are there. They are so sensitive. We see so many suicide cases, etc.
Yes.
Because somebody said like this to me, I could not bear it. Or for example, we carry certain stress of the office, here, there, home. So what is important here is that any thought that disturbs the mind, or for example, if a child is come new to the college, staying in the hostel, is not able to adjust because one or two children today they are pampered lot, so they miss their parents. They feel hurt when they are their colleagues speak something or the teacher shouts in the class. So these things somewhere down the line, it is not only here related to hypothyroidism, but overall for that matter, somewhere we have to let go things and be peaceful. Life is unpredictable. So very important to us is let go things, be peaceful, be happy. We need to enrich every moment of our life.
Yes.
Because what I thought 10 years back and which made me cry, I don't remember it today. This is very important. So even meditation helps. meditation helps. Then there we now have so many channels speaking about different like Sadhguru's channel. Then we have got so many which help us to know that what is important to us is. Why am I stressing on this is because this all leads to various diseases. If you can control your mind, you can control everything. With this, I think I have shared with you a little bit of knowledge of hypothyroidism and also related to mind and how it can cause a havoc in our health issues.
ಓಕೆ, ಎಸ್ ಡಾಕ್ಟರ್, ಈ ಒಂದು ಲೆಟ್ ಗೋ ಥೆರಪಿ ಅಂದರೆ ಏನು ಅಂತ ಕೂಡ ತಿಳಿಸ್ಕೊಟ್ರೆ. ಇಷ್ಟು ಹೊತ್ತು ನಮ್ಮ ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಹೈಪೋಥೈರಾಯ್ಡಿಸಮ್ ಅಂದರೆ ಏನು, ಹೈಪೋಥೈರಾಯ್ಡಿಸಮ್ಗೆ ಯಾವ ರೀತಿಯಾದಂತಹ ಚಿಕಿತ್ಸೆಗಳನ್ನ ನೀಡ್ತಾರೆ, ಜೊತೆಗೆ ಹೈಪೋಥೈರಾಯ್ಡಿಸಮ್ ಇರುವವರು ಯಾವ ರೀತಿಯಾದಂತಹ ಎಚ್ಚರಿಕೆ ಕ್ರಮಗಳನ್ನ ತಿಳಿದುಕೊಳ್ಬೇಕು ಅನ್ನೋದರ ಕುರಿತಾಗಿ ತಿಳಿಸ್ಕೊಟ್ರೆ. ಇಷ್ಟೆಲ್ಲ ಮಾಹಿತಿಯನ್ನು ತಿಳಿಸ್ಕೊಟ್ಟಿದ್ದಕ್ಕಾಗಿ ನಿಮಗೆ ಧನ್ಯವಾದಗಳು ಡಾಕ್ಟರ್. ಎಸ್ ವೀಕ್ಷಕರೇ, ಇಷ್ಟು ಹೊತ್ತು ನಮ್ಮ ಈ ಒಂದು ಸಂಚಿಕೆಯಲ್ಲಿ ಹೈಪೋಥೈರಾಯ್ಡಿಸಮ್ ಅಂದರೆ ಏನು, ಹೈಪೋಥೈರಾಯ್ಡಿಸಮ್ಗೆ ಯಾವ ರೀತಿಯಾದಂತಹ ಚಿಕಿತ್ಸಾ ಪದ್ಧತಿಗಳನ್ನ ನೀಡಲಾಗುತ್ತೆ ಅನ್ನೋದರ ಕುರಿತಾಗಿ ತಿಳಿಸ್ಕೊಟ್ವಿ. ಮುಂದಿನ ಸಂಚಿಕೆಯಲ್ಲಿ ಮತ್ತಷ್ಟು ಮಾಹಿತಿಗಳೊಂದಿಗೆ ನಿಮ್ಮ ಮುಂದೆ ಹಾಜರಾಗ್ತೀನಿ. ಅಲ್ಲಿವರೆಗೂ ನಿರಂತರವಾಗಿ ನೋಡ್ತಾ ಇರಿ V4 News 24/7. ಇದು ಮುನ್ನುಡಿ, ಮುನ್ನಡೆಗಾಗಿ.